My name is Jamie Eidlin. I am the Associate Director of Graduate Admissions, and I'm also joined by my colleague, Philomena Tricelli, Associate Director of Admissions for our accelerated programs. Today, we're going to give you an overview of all of our programs, as well as go into breakout rooms and have a Q&A period. Just a few housekeeping tips before we start. We ask that you please stay muted throughout the entire presentation and to save your questions for the end of the presentation. This will be recorded. You'll receive a recording in a few days. So if you do have to leave at any point or you want to review the materials, you'll get that recording emailed to you. And if for whatever reason you don't get your question answered, or if you have a specific question that you'd like to talk about offline, just send us an email at admissions@nursing.upenn.edu and we will get to your question. Now I will stop sharing and Phil, you can take it away.
Okay, awesome. Thank you, Jamie. Let's see here. Okay. Hopefully everybody can see my screen, and I apologize if I get very close to the screen. It's because I need new glasses and I can't see as well. So if you see me kind of zooming in and zooming out, that is why. So welcome everyone. I'm Philomena Tricelli, and I work with our accelerated second degree students here at the University of Pennsylvania School of Nursing. And today we're just going to do a nice overview of the accelerated nursing program. And as Jamie said, at the end of both of our presentations, we'll break out into our own breakout rooms, and then we can definitely go and kind of dive into more of the details of the accelerated program. But we're going to talk a little bit about the different program options, the timeline, the prerequisite courses, as well as application requirements, some academic opportunities, as well as some the specific graduate specialties that you're eligible for. So under our accelerated umbrella option, this program is designed for students who have a bachelor's degree or will have a minimum of a bachelor's degree in a non-nursing field and have decided to go into the field of nursing. And we have two options for students that they can choose from. You can come into and apply to our BSN second degree option, which is for students who know they want to go into nursing, they know they want to be a nurse, but they're not positive of the specialty or population they want to work with. And they really want to keep their options open before kind of determining, a specialty or an advanced practice nursing role. Then we have our BSN MSN program, and this is for the student who knows what graduate nursing specialty they're interested in. So they know they want to be a nurse practitioner, but beyond that, they also know the specialty. I want to work with pediatrics and oncology. I want to work with I want to be a family health nurse practitioner. I want to work with women's health, acute care, whatever it is that you have an idea of, at least population, setting, and the environment that you see yourself in at the advanced practice nursing role. So our BSN MSN students apply to our nurse practitioner tracks and our nurse midwifery and administration tracks. And our students receive both a bachelor's, a second bachelor's, and a master's degree with that option. Our program is scheduled to start in June of 2022. We only have one start date. We only have one cohort per year for our accelerated program. The length of the BSN is currently 18 months. And this, whether you come in BSN second degree or BSN MSN, the BSN portion of the program is the same for everyone. You're one cohort for the BSN portion, and it's 18 months for that first degree. And of course, the length of the specialty at the master's level really depends on the specialty that you choose. Most of our nurse practitioner tracks are between 12 and 16 months. Our nurse midwifery and administration specialty are 18 months. Nurse anesthesia is one of our graduate specialties, but our accelerated students cannot apply to the anesthesia program, but just know that it is available at Penn down the road, and it is a 3-year full-time program as well. Our cohort is a pretty small cohort. We're probably around 85 students a year. We get around almost 700 applications, give or take. Some years it's closer to 7, some years closer to 650. And our admit rate over the last few years has averaged about 35%. We're a national program, so as you can see from the wonderful places everyone has logged in from, you come from across the country as well as internationally. So it's a really wonderful, diverse group of students with great backgrounds, a variety of different majors and career previous careers that they've had in business or military, coming into the field of nursing. Our underrepresented minorities are usually over 20%. It's something that we work really hard to continually work to improve, and it's something that we're committed to. But that's just kind of just a highlight of the enrollment data, and we can talk a little bit more in our breakout session. So just a little bit on the timeline, because the timeline for the accelerated program is a little bit more lengthy, I would say. So our application will go live in July of 2021, usually July 1st, but you never know. And then our application deadline is currently October 15th, 2021. It will never be earlier than October 15th, but definitely check our website. You know, we are looking at possibly a second deadline or possibly moving the deadline a little bit later. Admissions committee is usually held in January of 2022, and our goal is to notify all applicants of their decision in February of 2022. And then our program begins in early June. So as you can see, you guys are a perfect time to kind of research the program, because it gives you time to prepare for your application and be able to submit it by the fall. Now, in order to apply to the accelerated nursing program, you do have to have certain prerequisite courses completed. The prerequisite courses must be completed before you officially start the program, which means you can apply to our program while you're completing those prereq courses. Just aim to have all of the prerequisite courses completed by May 31st of 2022. That also goes for your degree as well. So if you are currently an undergraduate student and you're getting your bachelor's degree, you want to make sure that you technically and officially graduate in May of 2022, so you can begin our program in June. The prerequisite courses can be completed at any accredited college or university, including online. We accept online courses as long as those online courses are from an accredited college or university. We accept virtual labs. So definitely know that you have a lot of options in terms of when and where you complete these courses. And the most important thing is that you keep the prerequisite courses simple. These are introductory courses. We don't need advanced level chemistry or bio, or, you know, we're not looking for pathophysiology. These are introductory courses. So we need 2 semesters of anatomy and physiology with lab. Depending on where you live in the country and what the universities offer in your area, you're either going to do 1 semester of human anatomy with lab or 1 semester of human physiology with lab. Or you're going to do anatomy and physiology part 1 and anatomy and physiology part 2. So you want to make sure you have 2 semesters that cover anatomy and physiology. 1 semester of intro to chem, semester of intro to bio. We do not require the biology lab, but we do require labs for all of our other science courses. 1 semester of intro to microbiology. And then of course we have intro to nutrition and intro to stats. So those are the prerequisite courses. They must be completed before you can start the program. But again, you can apply to our program while you're completing those courses. There is an optional course of healthcare ethics, bioethics, medical ethics that if you do complete, we can give you transfer credit for it, and you would not have to take it at Penn, but it is a required course for the bachelor's degree. So many of our students do not complete the course and can complete it while they're at Penn. But these are the prerequisite courses. And then again, if you have any specific questions, we can talk about it at the breakout session. One other thing is that you must have a grade of C or higher in every class in order to officially transfer. Application requirements. So we're really lucky. We have a wonderful application system. Everything is submitted online. Even your transcripts at this point are mostly electronic as well. So we have a personal statement that's part of the application. And that's really where we're going to ask why nursing, why Penn, what your goals are, what you hope to accomplish, and why you want to do it at Penn. 2 recommendations for the accelerated program. I strongly recommend that you have at least 1 academic recommendation. If you have been out of, graduated 10 years ago, you've been working in corporate America for the last 10 years, you can submit supervisor recommendations. But I strongly recommend an academic and or supervisor rec. Stay away from coworkers, neighbors who are in the healthcare field, friends who are in the healthcare field. You want someone that can really talk to either your academic ability, your leadership qualities, that sort of thing. We require 2 recommendations, but students can submit up to 3 recommendations. And that's where your 3rd rec could be maybe from somebody that you're shadowing and you've been shadowing for a few months. Maybe you're volunteering at the hospital. It could be your supervisor from your volunteer position. That third recommendation is up to you in terms of who you submit. All of your college transcripts, luckily we only need unofficial transcripts when you're applying. Official transcripts will be required after you were admitted, but we need all your college transcripts. So even if you took a class in the summer and it was our art history class and it doesn't, apply to the nursing program, we still need that transcript. So you want to make sure you get copies of those. Resume, we're going to talk a little bit more about resume on the next slide. Great news, the GRE used to be required for our accelerated BSN MSN students, but it is no longer required as of July 1st, 2021. So you do not have to worry about the GRE or waiving the GRE requirement. It's no longer an application requirement. We do have a video interview. It's probably more of a video essay, but we give you question prompts. And then we give students anywhere from 5 to 8 minutes, depending on the application, in terms of answering the question. And it's just an opportunity to just kind of get to know you a little bit better. Because we have so many applications, we're not able to offer in-person interviews, at least we haven't over the last few years. And then we've got the financial aid requirements if you're applying for financial aid, and the deadline's usually in December. Just really briefly, what is the admissions committee looking for? It's something that, the one thing I will say is that we're very much a holistic admissions office in terms of we have a holistic review to the application process. We look at each applicant individually, and because the accelerated program applicants are so diverse, you've got students coming straight from undergrad, you have students who've been out, applicants who've been out for 10 years working in engineering or have been in the service, or et cetera, et cetera, et cetera, that every application and applicant has just something different to offer. So we do have a holistic approach, but this kind of gives you big picture. There's kind of two sides to the application process. There's the quantitative side. So we do look at your undergraduate GPA. We recommend that you have a 3.0 or higher in your undergraduate, bachelor's GPA. The average of the admitted class is usually around a 3.5. But I promise you, we do accept students with GPAs under a 3.0 because we do have that holistic approach to the admissions process. So if you are a new graduate, the GPA is much more important in the admissions process versus someone who has been out and maybe has a graduate degree or has been working for a few years. That undergraduate GPA holds less weight as you kind of move, along in terms of your experiences. The other piece that we really look at are your science grades, and anatomy and physiology are extremely important in terms of the success of the program and how successful you'll be in the program. So we want to see strong anatomy and physiology grades. And we also want to see anything you've recently completed, any courses you recently took. We want to see that you're doing well in those classes. So if you took chemistry freshman year, 8 years ago and received a C, that's going to have a little bit, it's not going to affect your application as much versus getting a C last semester and you're applying this summer. Okay, so just something to think about as you're preparing your application. And then the other piece is exposure to healthcare. I know it's difficult with COVID. There's probably a lot of you out there that had all these great experiences lined up, and then COVID hit and it changed everything. But try to attain as much exposure as you can, whether it's shadowing, volunteer work. If you have personal healthcare experience, you want to outline that and talk about that, whether it's in your personal statement, the video, or possibly in your resume. If you're a caregiver, you want to let us know. But we want students who've exposed themselves to the healthcare field, that they know what they're getting into in a way that they're prepared for the rigor of the program, and that they're committed to the field of nursing. There's a lot of wonderful healthcare related careers out there. And we want to know that you've done the work to make sure that nursing's right for you. The other thing with the exposure to healthcare is in the resume. So for the accelerated program specifically, we do recommend that if you have your resume, it doesn't have to be a work resume. It doesn't have to be 1 page. It can be 2 pages. It can be 3 if you really want it to be. Put everything on there. You can put, healthcare related experiences, volunteer experiences, places you've traveled, languages you speak, jobs you've held. We want to know as much about you as we possibly can. And sometimes there's information that doesn't make sense in the essay or doesn't make sense to talk about in your video. Put it on your resume because we'd love to see it and review it. These are all of the graduate specialties. We're going to talk a little bit more about that when we talk about our master's programs, but these are the specialties that are offered at the advanced practice nursing level at Penn. One of the great things about our BSN MSN program at the University of Pennsylvania is that we allow students to take time off between the BSN and the MSN. So a lot of our master's programs can be completed on a part-time basis. We have, I think it's 11 nurse practitioner specialties. They can all be done on a part-time basis as well as full-time. So our BSN MSN students that apply to the FNP program, they can graduate with their BSN, go out into the workforce, come back and finish their master's degree either part-time or 2 years later full-time. We give all of our students 5 years to come back and complete their master's degree from when they graduate with their BSN. Students are also not locked into your specialty. So if you apply BSN MSN for women's health, you get to Penn, you're going through your clinicals and you realize you really want to do pediatrics, you can request to change your specialty and switch your specialty. It's not guaranteed, but just know that it is a possibility and you can switch. And many of our accelerated students do change their mind. I'd say at least 30, maybe 40% will change their specialty between the time they start the BSN and finish the MSN. And then we also allow some of our students to take graduate level courses while they're finishing their bachelor's degree that will count towards their master's degree. The only exception is that our nurse midwifery program is usually completed on a full-time basis. And then of course our nurse anesthesia program is a DNP program. Our accelerated students cannot apply to the DNP program at this time, but it has to be done full-time. But we do give you guide you in terms of applying to the DNP program later on in your career. And then some of our programs, which Jamie will talk about, require work experience. So you'll get more information on that. These are just some of the opportunities that are available. We have a wonderful state-of-the-art simulation lab that is a huge component of our program. Research is huge at Penn. So if you have any interest whatsoever of either learning about research or knowing you're going to make research part of your career or wanting to explore research, it's a great place. While you're finishing your program at Penn, you can easily work, I shouldn't say easily, but you can work maybe 5 to 8 hours a week while you're in the accelerated program with a faculty member doing research that you're really passionate about. Maybe it's palliative care, maybe it's women's health, dementia, working with technology. We do a lot of work looking at apps and chronic care and things like that. So there's lots of opportunities to get involved in research. It can be involved in student organizations, but we also have combined master's degrees, which we're going to talk about the graduate level on when Jamie starts her presentation. So I won't go into detail with that. We also have a sub-matriculation option. So let's say you want to be a nurse. One day you will eventually want to be a nurse practitioner, but you are not sure of your specialty. You can apply to our second degree program. And then once you get to Penn, you can sub-matriculate and apply to our master's program while you're finishing your bachelor's degree. So there's always opportunity to continue your education at Penn and to really figure out your goals and take the time to figure out your goals. We're here to support you as you're going through the process. And we give students lots of opportunities and flexibility. We do have some study abroad programs. Of course, with COVID, I don't know when they'll be back, but hopefully 2022 will be a year where we can return to some of our study abroad options. This is for our accelerated group. Some of the programs might some of our graduate students might be eligible for some of these programs, but just know that we do have study abroad programs specific to nursing. You go abroad with our nursing faculty. And you really just spend time in those countries learning about the healthcare system in that country and comparing it to the US. So it's a short-term study abroad program. And then financial aid, which we can talk a little bit more about in the breakout session, but we do offer financial aid. We offer a combination of need-based grant, merit-based scholarships, and then of course there's the loan component of it as well. Okay. All right, that's it for me. Sorry, I was probably talking too fast. All right.
Okay.
Handing it over.
I just share my screen. I have a lot of information to cover. I will probably be talking just as fast, but again, we have the Q&A session, and of course we can always talk afterwards via email should you miss anything. So I am going to very briefly go over our graduate program options, our application requirements and tips, which is fairly similar to the accelerated programs, some information on student services and financial aid, and then of course a Q&A. So first is our MSN programs. You just saw this list, but as a refresher, we have a variety of nurse practitioner programs that are across the lifespan or focus in specific areas. Our nurse midwifery program is called an advanced specialist program, which means at the end, it's a dual program. So you're eligible to sit for the women's health and nurse midwifery national exams. And then we also have 2 administration programs, which are non-clinical. They don't lead to a nurse practitioner license or advanced practice license. They're more focused on administration and leadership, as the names imply. As Phil also mentioned, we do have some dual degrees that are more popular with our administration programs just because of the amount of work that you would need to do for both programs. It is certainly possible to do a dual degree with our nurse practitioner programs. It's just a little more intense. But you can do a dual degree program with a master's in public health, a master's in bioethics, or a master's in law. And what most people do is they start our programs. So they start the MSN program first, and then they apply to the other program. It tends to be a little easier if you do that once you get here as a current student. All of our MSN programs can be done full-time or part-time. Most full-time are about 1 year. The longest programs are our family NP and nurse midwifery programs, which are about 1.5 years full-time. Or you can do them part-time. Most students do them within 2 to 3 years. About 2/3 of our MSN students are doing our programs part-time, so it is a very popular option. Our programs are on campus in Philadelphia. Because of the pandemic, courses have been offered remotely, but simulations and clinicals have been in person. This fall, we right now are moving to a hybrid offering, and this will be evaluated every semester. Clinicals are organized by the school, so that's one less thing you need to worry about. And clinicals take place in Pennsylvania, New Jersey, and Delaware. For those of you not from here, those states are very close together. I know sometimes we get applicants from all around the country and they've never been here and don't realize that New Jersey and Delaware are only 30 minutes from Philadelphia. And upon graduation, you're eligible to sit for your program's national certification exam. So you can practice in any state. There might be specific state requirements, but our programs allow you to sit for the national certification exam in that area. You might be wondering what program is right for you if you are currently not a nurse and interested in advanced practice nursing, or you're deciding between the two. Our programs fall into the APRN consensus model, where the focus of care is based on the patient needs, not the clinical setting. So if you become a pediatric primary care nurse practitioner, you can only take care of pediatric patients in the primary care setting. This doesn't mean you can or cannot work in a hospital or other type of organization. It just restricts the level of acuity and the type of patients you can see. So again, just think carefully about what program you want to do. There are a variety of postmaster's options should you find another passion, but most programs do focus around this model. This is a very basic outline of the clinical MSN curriculum. All students will take what we call the 3 Ps, the core curriculum, which is advanced pathophysiology, pharmacology, and physical assessment. All MSN students take a research class which culminates with a project where you could potentially publish in a journal or present at a poster presentation. So it's nice you can take that research with you. You take theory courses specific to your population, and then you do your clinical placements. And this is what the administration MSN programs look like. The health leadership program is a bit more flexible in the curriculum. There are a lot of electives. There are a lot of electives you can take at other Penn schools. This is the most popular program to do a combined degree. Many of our students in the health leadership program wind up doing a combined degree. Our nursing and healthcare administration program, the curriculum is a bit more structured, and there also is a practicum that you do at a place that you are interested in. We do have a variety of minors. Some of them are just designed to increase your knowledge in a certain area. Others, such as adult oncology or palliative care, allow you to sit for the national certification exam in that area. Most are only around 3 courses. They are a little easier to do for part-time students. Full-time, it can potentially add time to your plan of study. And those with an asterisk can be completed as a standalone postgraduate certificate. So if you complete your MSN program anywhere, not just Penn, and decide to come back and get certified in adult oncology, you can do that as a certificate program. As I mentioned, you can complete the programs full-time or part-time. Part-time, you can apply for any semester. So you can start in spring, which is mid-January, summer, which is mid to late May, or fall, which is mid to late August, late August or early September. Full-time, it does depend on the program you are applying to. So do pay attention to those dates. Specific programs for full-time start in specific semesters, either summer or fall. There are no full-time start dates for spring. Our acute care programs require work experience. There is a lot of information on the slide. This is also available on our website if you don't catch all of it. But basically, if you are applying to our adult acute or pediatric acute or neonatal programs, you need at least 1 year in that population area. The neonatal program requires at least 2 years of experience. Your work experience should be full-time RN experience, calculated after orientation. That's really important. Some orientations can be 3 months long. So you need to make sure that the work experience, you have it for after orientation, and it needs to be within the last 3 to 5 years. If you're not quite sure if your work experience will count towards the program, you can always email us your resume and we will let you know. Our primary care programs, so any programs, MSN programs you don't see on this screen, they don't require work experience, but it is strongly recommended. It really makes you a more competitive applicant, and we recommend at least 1 year by the time of application. It doesn't have to be in that area. Again, it does help, but it's not required. And our incoming students have an average of 3.5 years of work experience. I like to highlight our non-degree option. As a prospective applicant, you can complete up to 2 non-clinical master's courses as a non-matriculated student. Most people complete pathophysiology and pharmacology. There is a small application and it follows the MSN application cycle, which I'll get to at the end. This is a great option if you're not quite sure what program you want to apply to, if you might be concerned about your academics and you want to show that you can handle the rigors of a graduate program. This is a nice option before committing to a 2 to 3 year long MSN program. And if you wind up applying to Penn and getting admitted, these classes will transfer into your MSN program. Next, I'm going to go over our DNP programs. First is our DNP and nurse anesthesia. And Philomena mentioned that accelerated students can't apply while in the program, unlike the MSN programs. You can still work with us and work with student services to take graduate level courses that will transfer in if you decide to apply to the nurse anesthesia program as an alumni. So this program is 3 years, only offered on a full-time basis. It is also on campus here in Philadelphia. You only need a BSN to enter. You don't need an advanced degree. We are currently admitting about 2 years in advance. So this year's applicants, fall 2021, are applying for summer 2023. The 2022 application is closed. The next application we're taking is 2023. There are specific work experience requirements. You need to have at least 2 years of full-time RN work experience post-orientation in ICU or critical care, working with the most critically ill patients. We do prefer at least or 2 years or more. Competitive applicants typically have at least 3 to 4 years of work experience at time of application. And there are specific areas that we do not accept, which are on the screen. The curriculum is fully integrated. So a lot of programs, you'll do a year and a half of didactic courses, and then the last will be your clinicals. The nursing anesthesia program starts in May, and in August, you're in your clinicals. So it is fully integrated between your didactic courses, simulations, and clinicals as well, which really allows for a really robust curriculum. We have a primary site model, which allows our students to be mentored and have a home base. So you always have your primary site that you return to each year, and then you can rotate through the different specialty rotations. We have 2 postmasters DNPs. The first one is just called the postmasters DNP. And then we have an executive leadership DNP. These require an advanced degree. And the difference between them is really the amount of experience our applicants are coming in from. So the postmasters DNP is designed to expand the skills of master's prepared nurses. So there is not a prescriptive work experience requirement. We do recommend that you have a few years of post MSN work experience, but it is not required. You do need to have an MSN or a master's degree in nursing. It doesn't have to be an advanced practice degree. It can be an education, administration, leadership. The executive leadership DNP is designed for nurses who already have leadership experience and potentially executive level skills. The requirements for this, you need an MSN or related master's degree, so an MBA, MPH, and you need to have at least 2 years of leadership and fiscal management experience. We're not very prescriptive with that. So if you are interested in this program and not quite sure if your experience meets the requirements, again, send us your resume. We're happy to steer you in the right direction. Both of these programs are 2 years part-time and 100% online with a few on-campus intensives. Of course, due to COVID, our intensives have been online, but we hope to resume in person as soon as we can do so. Both of these programs culminate with a DNP project that can be completed at your place of employment that examines changes and innovation in healthcare systems or outcomes. We did just have a webinar on these 2 programs, and the recording is available on our website. And last but not least, we have our PhD program. The goals of the PhD program are to develop as a scholar and a scientist. The PhD program compared to the DNP program looks to examine a research phenomenon in nursing science. And one of the driving factors is fit with faculty. We really want to make sure that you will have a mentor to guide you throughout the entire program. So you are encouraged to reach out to faculty who may align with your interests. Full-time students are fully funded for the first 4 years, which includes a living stipend and covers your tuition fees and health insurance. And this program is on campus. This is the PhD program curriculum. Depending on how you're funded, you'll either come in with a teaching assistant position or a research position within a research center. One highlight is that you can take the statistics course sequence at another school. So if you are particularly interested in a certain area, It's nice that you can explore different courses. So some of our students will take the statistics sequence at the School of Social Work or Wharton, the business school. So are not a great way to, you know, sort of get out of the mold and explore different schools. It ends with a dissertation, which could be a 5-chapter dissertation or 3-article dissertation. That really depends on your research. And median time to degree is about 3.92 years. It's, again, this really depends on your research and on your dissertation, but most students do finish within 4 years. The Penn Advantage, I could really go on and on about this, but I know we have a limited amount of time. And a lot of this is what Philomena said, but we have a huge community focus. Our clinicals are focused on the community. There's a really strong community within the School of Nursing. We try and give back to the community in different ways. We are located in West Philadelphia, and we try to give back, whether through clinical placements or through events, you know, in appreciation of the community hosting us. So for example, the past few years, the Center for Global Women's Health has hosted the West Philly Women's Day, where students and faculty and staff put on a day of events for the community of West Philadelphia and beyond to get health services, screenings, provide education. And, you know, again, unfortunately, it didn't happen this year, but hopefully it will resume. There are a variety of national and international opportunities. Sometimes you might have the opportunity to complete a clinical at another hospital around the country. And we do, again, in normal times, have short-term study abroad opportunities where you can go during a break or perhaps complete a clinical abroad. Research is huge. You do not need to be in the PhD program to conduct research. And leadership is a big part of the program here. We're not just training you to be an advanced practice nurse or a PhD student. We're training you to be a leader in the community, in whatever community you join after graduation. Okay, I think I'm going to start talking fast because I want to make sure we can get to your questions. So I'm not already talking fast enough. So I'm going to go through application requirements and tips. These are the application requirements. I'll go through some of them. So in general, what do we look for? As Philomena said, we have a really holistic admissions process. There is no one minimum for certain things, you know, aside from work experience for those required programs. But we're not just looking at your academics or your essays or anything. We are looking at the entire picture. And we are looking at all materials that you submit. We equally weigh all materials in the review process. Biggest piece of advice is to start your application early. It'll open in early July, and starting early will allow you to submit the most competitive application possible. Every year we get people the day before the deadline that have problems, that have questions. Just open it up in early July. See the requirements, see what you need to do. You don't need to submit it on July 2nd. You don't get extra points for doing that, but this is just for your benefit. Your resume, we like to see a lot on your resume, so feel free to include more information. You can include all professional experience, volunteer experience, and extracurricular activities, honors, awards, leadership experience, shadowing, if you're a clinical instructor, a preceptor, research, significant hobbies. This is a great way, as Philomena said, to highlight achievements and other things that you may not be able to write about in your essays. Your essays, we want them to be easy to read, double-spaced, 12-point font. We look at hundreds of these a day, and it really benefits us and our eyes if they are easy to read. You want to make sure that you proofread and remove track changes. Whatever you upload into the application is what we see. And 1 or 2 spelling mistakes isn't going to make or break your application, but the harder it is to read, the harder it is for us to evaluate. So proofread, look over it. No one's first draft is the best draft. So just make sure that, you've really reviewed your application and you're submitting the best one possible. In terms of content, we really want to know why this program. Out of all the nurse practitioner or DNP and PhD programs, what is it about this program that you're interested in? How have your experience prepared you for this program and role? For our PhD and DNP postmaster's programs, we want to see a demonstrated understanding of your potential dissertation project or DNP project. We don't need a prescriptive outline with citations and everything that you plan to do, because that's the whole point of the program. We just want to see that you've thought about your potential dissertation topic or project interest and that you have an understanding of it. And your career goals and your aspirations, again, we don't need a 5-year plan. No one expects that. But again, we want to see that you've thought about what you plan to do with this program. We require 3 letters of recommendation. You can submit up to 5. Again, you don't get extra points for submitting up to 5. This is really for you to, if you're deciding between 3 and 4, now you don't have to. Similar to what Philomena said, we do like to see at least 1 academic reference. If you've been out of school for a long time and you don't have a connection to a faculty or advisor, that's perfectly fine. You also can submit older recommendations. So if you've kept in touch with a faculty member for the past 10 years and they can write a good recommendation, feel free to do so. Your employer should be your direct manager or supervisor, and professional is someone else who knows you in a different professional capacity. So overall, we're looking for quality, not name recognition or Penn alumni. We'd much rather see someone's name we've never seen, who knows you really well and can write a really substantive recommendation than the CEO or CNO or dean. The letter of recommendation should build upon other aspects of your application, and it can emphasize strengths and weaker parts. So if you're, for example, concerned about academics, but you recently did very well in a non-degree course, your professor could write a recommendation and comment on how fantastic you did in that class. And again, just to stress, only academic or professional references. I'm sure all of our parents and grandparents and aunts and uncles could write really fantastic recommendations, but that's not what we're looking for here. It should only be academic or professional recommendations. And also for our programs, hooray, starting this year, the GRE is no longer required for any program. Previously, it was required if your BSN GPA was under 3.2. That is no longer the case. You don't need to submit your GRE scores. The TOEFL or IELTS is required if you're a non-native English speaker or if your undergraduate degree was not conducted in English. We don't have a preference for the test. We just need one of those. And the minimums are on the screen. Transcripts, similar to the accelerated programs, we need transcripts from your BSN program and all additional degrees or coursework completed. We do not need official transcripts. You can submit your unofficial transcripts during the application process. Official transcripts are only required if admitted. If you attended school outside the United States, we'll need your transcript evaluated through WES or CGFNS. Other application items, we do need your RN, and if you have an APRN license, upload whatever you're issued. If you have a scan of your physical copy, a screenshot of the website, it doesn't matter, we just need that. If you're practicing outside the United States, but you're licensed to practice in another country, you do need to complete the CGFNS certification exam. That can take a while. We do recommend starting that at least a year in advance. Each program requires a statistics course that just needs to show up on your transcript. It either needs to be for our DNP or PhD programs, a graduate level statistics course. For our MSN and nurse anesthesia programs, it needs to be an introductory statistics course. For the postmasters and executive leadership DNP programs, there is a clinical verification form on the application that, as the name implies, you need to verify how many clinical hours you did. No need to worry about that right now. Just keep that in the back of your mind and you can access it on the application. And interviews are by invitation only. We will contact you. Okay, I'm going to briefly touch on student services, but there are so many resources. There are almost too many to count. You are not just a Penn nursing student, you are a University of Pennsylvania student, and you have access to a variety of different services. So of course, our own Office of Student Services, which can help with registration and advising, career services. Some of us have been haven't interviewed in a while, haven't written a new cover letter in a while. So they have, in addition to career fairs, some really great resources for applying to jobs. Counseling and psychological services really runs the gamut. If you're stressed, you want to talk to someone. If you'd like to start or resume therapy, they have a lot of great resources. The Weingarten Learning Center is fantastic, and it has something for everyone. So if you've been out of school for a while and you want some study tips, if you need help writing an essay, if you need assistance from Student Disability Services with any accommodations, Student Health Services offers primary care, nutrition services. They even have massages and acupuncture, which is great. And then the Graduate Student Center puts on a lot of different programs throughout the year, a great way to meet other graduate students. And when they're in person, they offer free coffee. So great place to go. Now I'm going to very briefly, even more briefly than that, touch on tuition and financial aid. I'm not a financial aid counselor. We have fantastic financial aid counselors here. This is just to give you the very basic information. So your program cost depends on how many course units you take. The average course at Penn is worth 1 course unit, and it's equal to 4 semester hours. There's no difference between in-state, out-of-state, MSN, DNP, it's all the same cost. These are the 21-22 tuition and fees. The full-time estimate includes estimate for personal and living expenses. This may not apply to you. You can see the full breakdown on your website. You may not have to worry about these things. Yours might be more expensive, less expensive. These are just estimates. We do offer some scholarships. So we have needed merit-based awards for full-time students. The president of the University of Pennsylvania, Amy Gutman, and her husband donated $2 million of their own money, specifically to the School of Nursing. So we, this past year, started the Gutman Leadership Scholars Program. We have veteran benefits. We have the same scholarship for Peace Corps volunteers. If anyone here is an employee of Penn Medicine, any Penn Medicine hospital, and the Children's Hospital of Philadelphia, you get what we like to call the buy 3, get 1 free scholarship. So in addition to any benefits you receive as a Penn Medicine or CHOP employee, after completing 3 CUs at Penn Nursing in a calendar year, that's January to December, excuse me, you're eligible to receive a scholarship for the cost of tuition of the 4th CU taken in the same calendar year. So that is a really great opportunity for our Penn Medicine and CHOP employees. Additional funding opportunities, many of our students do have to take out loans. There are federal loans, there are private loans. There are benefits to both. It really just depends on your situation. I encourage you to explore all options. There are also federal loan repayment programs. You may have heard of the Public Service Loan Forgiveness Program. There are also specific nursing corps repayment programs and health service programs as well, where you agree to work in a certain area or a federally qualified health center for a certain amount of years, and they'll repay your loans. There are also external scholarships available. We have a pretty healthy list on our website, or you can explore on your own. There are a lot of resources out there. I'll share a story from a former colleague who always used to tell this story, that when he was searching for external scholarships, he found one for twins. And he said, you didn't have to be pretty, you didn't have to be smart, you just had to be a twin. So there are truly scholarships out there for every make, model, and creed. You just have to be creative. Now, finally, our deadlines. So the application will open early July, and depending on what program and what enrollment status you're applying to, there are specific deadlines. However, our review process is on a, for our MSN programs are on a rolling basis. So MSN, if you're interested in starting part-time spring 2022, the deadline is October 15th, 2021. The latest notification you'll hear back by is mid-December. You might hear back in early November. You might not hear back until mid-December. It's a rolling process. MSN full-time, summer or fall, for full-time enrollment, the deadline is November 1st, 2021. If you're applying full-time summer, the latest you'll hear back is mid-February. If you're applying full-time fall, the latest you'll hear back is mid-March. If you're interested in the MSN programs, part-time summer or fall, the deadline isn't until March 15th, 2022. Latest notification for those part-time summer is late April, part-time fall is mid-May. We always say, my coworker heard back and I haven't heard back. There's no rhyme or reason as to who hears back when and who doesn't. We have a lot of applications to get to, and it truly is a rolling process. So I realize these are general, but you will hear back by these timeframes. For our nurse anesthesia program, the deadline is November 1st, 2021. And remember, that is for the 2023 cohort. You'll hear back in late April. The Postmasters and Executive Leadership DNP programs, that deadline is November 1st, 2021. You'll hear back in mid-February. And the PhD program, that deadline isn't until December 1st, 2021, and you'll hear back in mid-February. And again, just because the application opens in early July doesn't mean you have to submit July 2nd. You have plenty of time to work on the application, and we will have more recruitment events. We'll have specific program events. So don't feel that you have to submit right away. We won't be reviewing applications until after or closer to these deadlines. So you have plenty of time to submit an application. Now we're going to get to the Q&A portion. We can't record individual breakout rooms, so this is where the recording will end. Again, just if you have any additional questions, feel free to email us and we're happy to help.